Atrium was requiring by contract the insurance companies directly steer patients to them.
Why wouldn't the insurance companies blow the whistle and say, no, we're not playing along like this?
Well, this is the problem that we live in today's healthcare systems. You know, if we go back 50 years, insurance companies seem to have the power of steerage. But since hospital systems continue to combine and grow and effectively phase out and push out smaller hospital systems, we're seeing that hospital systems in the healthcare world that we live in here in the United States has become the new too big to fail, like we saw in the banking systems back in 2008. And so the insurance companies they have to have the hospital system to provide value to their consumers, right? If I'm a Blue Cross and I say, well, we don't have Atrium in our network, well, then that limits the number of consumers that are going to want to buy my product, especially when Atrium owns now most of the hospital market share. So if I'm a consumer, I need to be able to see an Atrium provider. I will only we'll use a Blue Cross policy, for example, so long as I can see Atrium through that policy. So now hospitals have all the power.
The Department of Justice is saying that all of this really costs consumers money in the form of higher costs. Any way to quantify that? How much higher are we talking about?
Yeah, we actually can quantify that through recent studies. Matter of fact, an article just this week in the New York Times tracked multiple hospital systems throughout the United States that have grown through consolidation and acquisition. And what we're seeing across the marketplace is prices raising anywhere between 7% and even as high as 54% throughout the United States in other markets where this has happened.
Are other hospital systems across the country watching what happened today with the Department of Justice and Atrium?
They are. I will tell you that likely they're not all that too scared off by it. My fear is that because there's really no substance to this settlement, that hospitals are just going to keep doing what they're doing now.
And that was my next question, with no real penalty. Were you surprised by that?
I was, and you know, the details will come out hopefully as to why there was no penalty ensued. The challenge that we have here is in a situation like this is that the rest of the world is watching, and with hospital systems in every state. Listen, I'm in Texas. We have Baylor Scott and White here in Texas that continues to buy up hospitals as well, and they have a lot of the power. And I'll tell you, going back to what we said earlier, hospital systems don't need insurance companies like they used to. They'd like to have insurance companies on board, but what we're starting to see now is in certain marketplaces, hospital systems are now starting their own insurance companies. So this is the next trend that we're starting to see that allows them to continue to gobble up market share and really drive a wedge in the marketplace. And that's a very scary place to be.
Now, we did get a statement from Atrium Health this afternoon. It says the system did not violate the law. In addition, Atrium Health will not pay any penalties or fines, as we mentioned. Now, the statement goes on to say Atrium Health has always been a champion for patient choice.